So the Flinders Program actually is a framework for chronic condition management. It consists of 4 parts: medical management, self-management, coordination and coaching. Then within that framework there's a set of tools called the Flinders Program tools, which address the self-management component in particular, and then our training adds on coordination and coaching. So out of those 4 elements, the component that we don't provide is the medical management. And there's obviously great specialist bodies who advise on disease management, and we work to partner with them to produce a comprehensive chronic disease or chronic condition program. Over the last 14 years, we learnt originally about defining self-management, the components of self-management, so you could assess somebody's self-management from the coordinated care trials around 2000. And since then, we've actually been doing a lot of research around how we can apply the Flinders tools across a wide range of chronic diseases, including mental health conditions. So the idea was to test whether the Flinders Program can be used individually, one-to-one with a health practitioner and a patient, across a whole range of conditions. The underlying principle was that could we create a program or a model that could be applied in multiple conditions in the same person, but also across conditions for a whole group of people that might be coming through, particularly primary care and general practice. What we've got up to over the last 14 years is to create face-to-face programs, both 1 and 2 days. We've also got now the online modules, which you are now being introduced to. We also have electronic versions of the Flinders tools that are currently being piloted or trialled in the United States. So we sort of see that the Flinders tools provide a whole range of education and training opportunities for people, both at a distance and face-to-face, and we're moving into the electronic age. So where we're up to electronically is that patients will be able to develop a care plan with a health practitioner remotely. They might have a smartphone, and that smartphone will enable them to have downloaded their own care plan and be receiving texts and emails around their goals and problem solving with their coach. So what we've seen is that patients are really self-managing their chronic conditions or chronic diseases all the time anyway. And we've found that by assessing self-management around 12 basic questions, we can actually find where people are already self-managing well, and then we find the areas where they need some help. And basically they're the ones that are deciding where they need the help. So the health practitioner is then guiding them through that process to develop a 12-month care plan that they then can achieve goals according to their own priorities. And I think what's unique about the Flinders Program is that it provides a biopsychosocial approach. In other words, it focuses on the medical issues but also the psychological and social issues, which we now know impact on people's chronic disease management. So what we've seen in the way that patients benefit from this program is that they actually become more engaged and empowered in their own treatment. They're taking more responsibility for it, and then they're achieving goals that actually make a difference medically, socially and psychologically, not just for them but also their families. We've seen people make significant gains in their overall physical well-being, keeping out of hospital, engaging in new activities in life, changing their lifestyle, including losing weight, giving up smoking, doing more activity. So across the whole spectrum we've seen people make dramatic changes using the Flinders tools. So the core of the Flinders Program is the way that the Flinders tools take a health practitioner who's trained to use them through this process with a patient in a stepwise way that's structured and carefully designed so that all the core elements come out. And at the end of the day or during that process, the patient feels absolutely listened to, they feel engaged in language that they can understand and use, and that they can then feel more in control of their own conditions. And even though the self-assessment process doesn't solve their problems within a week or two, it gives people, the patients and the health workers, a pathway over the next 12 months to follow. So it breaks down big problems into small problems, and then people can actually set achievable goals to achieve those. So that's how the patient feels supported and engaged. And I mentioned the other components apart from medical management: coordination and coaching. So after the initial care planning process, the health professional, usually a nurse or another allied health professional, follows that person up and helps them coordinate access through the health system, but also acts as a coach, using motivational techniques and problem-solving techniques to empower the patient to really solve a few problems and make some gains. But the ultimate aim is that the patient learns a new set of skills that they can take control of their illnesses and their lives, and that's what really empowers the health professionals to keep on going with this program, because they see that it just doesn't help the patient with their diabetes or their mental health problem, it helps them with many aspects of their life.